teeth in a day, it might be called, or 24-hour teeth. That's not 24-hour permanent teeth. The traditional 24-hour process uses something like this. This little Frankenstein here is an acrylic arch that is attached to the teeth with more acrylic. Yes, I do mean acrylic like acrylic nails. Having this in the healing process is quite different than having our permanent prosthetic, because this material has microflexure to it. It is acrylic. In my practice before joining Nuvia, where I had done many of these cases, what I saw was a lot of fractures and breakages during the healing period. Any movement at all in the implants can cause them not to integrate fully, and then will cause them to fail. That's why, as soon as I started doing this process with Nuvia and the very rigid, virtually indestructible arches, I was an immediate convert. I did witness myself much less failure rate, much less breakage rate, and just a better outcome for patients. How can people trust such a new process? It's not really that new. Nuvia has been doing research and development on this process for over 10 years, invested so much time and money into making sure that we're doing things as efficiently and effectively as possible. In fact, I've been at this position since 2023. And still, I'm seeing updates and upgrades to the process regularly. We're never done innovating, we're never done researching and improving on this really unique and awesome process.
Also, Nuvia has an A+ rating with the Better Business Bureau, and we've been awarded Dental Implant Restoration's Company of the Year by Healthcare Business Review 3 years in a row.
How do you know if the implants are successful if the permanent teeth are placed on day one? Yes, we do screw the teeth in day one after surgery, right? 24 hours later. They are permanent teeth. At the 4-month visit, we actually remove the teeth so that we can individually test each of these implants to make sure that they have successfully integrated over the 4-month healing period. Now, I tell all my patients, when the teeth go in, they are prosthetics. They're gonna feel weird. But 4 months later, when they come out, that's when it's really gonna feel weird, because at that point you're gonna say, where are my teeth? I need them to feel like me again. But yes, we do remove them at the 4-month mark to make sure the implants are stable. Because at this point, we can catch, our success rate is over 99%, but in those very rare occasions where an implant may not integrate for one reason or another, we can catch it early enough to where the repair or replacement is a very streamlined process. So that's something that patients ask me sometimes too, is like, what if I have a failure? In the very rare case where you would, we have processes in place to take care of that and replace it at no additional cost. We want to make sure that you have something successful for the long term. Is anyone a candidate? No, not everyone is a candidate. A good way to find out if you could be a candidate is to take our 60-second quiz below in the description. That's a good starting place. Will Nuvia's teeth cause a lisp or poor speech? Anytime that you get something new in your mouth, whether it's a prosthetic or a denture, or even a retainer or Invisalign, you're gonna undergo some difference in speech. And this is because the tongue, the lips, the cheeks, all of this is musculature. As with any other muscle in the body, if you're gonna put it in a new environment or train it to do something new, it's gonna take time. So having this prosthetic in your mouth, this is even different from having like individual crowns or bridges. I like to compare this to an amputee getting a prosthetic leg. In the same way that that patient is relearning how to walk, sit, stand, you're gonna be relearning how to speak, chew, swallow, and all of this is because of those muscles. Things will get better with practice and repetition and getting things into muscle memory, and that's how we can get speech to be at or nearly at 100%. Some patients experience a significant improvement to their speech if they didn't have any teeth, or had jagged teeth to begin with. But it is really case dependent. The good news is that if you do have a difference in speech or a lisp, it is something that's addressable. Will Nuvia's teeth cause or worsen TMJ pain? I wouldn't say that they would cause or worsen it when they are tuned in to where they need to go for your anatomy. As with anything new in the mouth, when you start changing the proportions or orientations of things, in particular the jaw, you can experience some jaw pain. Typically, that's addressable with like a very simple bite adjustment or other chairside adjustment that we could make for you. I would say an overwhelming majority of patients have no problems with it at all. If you are a grinder or clencher at night and you're not wearing your night guard, that can sometimes have an impact on it too. But again, the good news is that if you do experience TMJ pain, more often than not, we're able to identify the cause and address it. Are Nuvia's teeth a one-size-fits-all? No, they are not. They are customized to you. So from the beginning, when you come in for your first visit and you're sitting in our chair, we as the restorative doctors are taking a series of measurements. We're taking digital x-rays, we're taking digital scans of the mouth, and that's when the design process really starts. By the time that you come in for surgery, we're pretty much 80% of the way there as far as design goes. And that's part of what makes our process so efficient, is that we are able to customize it to our patients in that 24 hours because of all the legwork that we've put in, even in just one visit before that. That makes our process pretty unique, and it gives you the smile that fits your face perfectly. I do have one question that I get often, and that is, how much does all of this cost? Nuvia put together a cost guide that is free, and you can download it in the description. It's gonna answer pretty much any question that you might have about the finances of Nuvia's 24-hour process. If you would like to hear from a patient who has been through this and has had his teeth for several years now, you should check out Ricky's story. He goes through the good and the bad and just his personal experience throughout the whole process. Until next time, keep smiling.